Hello viewers, welcome to our channel. So today we are going to talk about a medicine which are widely used in the fungal infection or especially we can say in a skin problems. So the name of that medicine is itraconazole. So itraconazole is used in the treatment of fungal infection. It is used to treat fungal infection of the mouth, vagina, skin and other parts of the body such as finger and toenails. Before moving forward, let us know that what are the brands which are prevailing in the market or which are running in the market. The first brand which I am going to tell you is Candy Force 200. This is very famous of the itraconazole. Why? Because this is the only brand which is very cheap in the market, okay, and also very effective. So if you really want to go with the itraconazole brand in the cheaper price, then go with the Candy Force 200. Other brand which is present in the market is ITMAC, which is a brand of McLeod Pharmaceutical. Then we can say Itiza, the brand of Abbott. Then Glenmark Pharmaceutical Candidates also is a good brand in the market. So like this, there are so many brands which are available in the market. So you can go any one of them, but the most famous one and most effective one I have already told you. So now we are going to know that how the itraconazole works. So itraconazole is a antifungal medication. It kills and stops the growth of fungus or we can say fungi by destroying its cell membrane, thereby treating your skin infection. Talking about the common side effect of itraconazole, well, after taking itraconazole, sometimes patient feels nausea, abdominal pain and headache. Now some special tips which I am going to tell you about this medicine is that the first thing I will like to tell you that you should not skip any dose of this medicine and finish the full course of the treatment even if you feel better. Because what happens, that when a patient feels better or patient illness is cured, what happens, they stop the medication. So what happen after 1 week or maybe after 15 days or sometime even after 2 days, this illness or we can say this infection appears again on their skin or wherever the part it is previously going on. So never stop the medication even if you feel better. Itraconazole, you can take it with food, preferably at the same time every day, I can say. And one more thing you need to take care that if you are taking the itraconazole, do not take any indigestion remedies like any antacid if you are taking. So you should not take this within the 2 hours of taking itraconazole. Sometime doctor may ask you to check your liver function by doing the test, liver function test, because what happens, this medicine do some harmful effect on your liver. So if you notice any yellowing of your eyes or skin or dark urine is coming or any stomach pain is there, so better you tell your doctor if you have some problem like this, and he will stop the medication or he will give you any other treatment with this. Not only this, if you develop any allergic reaction or any nerve pain or any hearing loss is there, then also you have to rush to your doctor and immediately consult with them. So viewers, now we will know that how itraconazole is used or when we have to take the itraconazole medicine. So itraconazole is used to treat fungal infection, as I told you before, caused by Trichophyton spp or we can say Microsporum spp and Epidermophyton floccusum viruses, we can say, because of which all the infections happens to the patient. Sometimes the infection caused could be by, we can say, ringworm infection or infection of feet will be there or infection in groin or buttocks will be there. So this medicine also treats persistent infection of fingernails and toenails, and persistent candida means infection caused by the yeast or infections of vagina or we can say the infection of mouth or throat in patient with lower resistance to disease. So it is also used in the treatment of cryptococcal infection and infection caused by histoplasma, aspergillus and blastomyces. So all these types of infection or we can say all the infection caused by because of this microorganism or because of this bacterial infection or by yeast infection. And viewers, as I told you before that do not stop these medicines before your course has been completed. Why? Because sometime what happens that drug resistance it becomes activated. And as I told you before or you have earlier seen in my video that what is drug resistance. So drug resistance is a condition. So what happen when you take this itraconazole and leave it in between, then the drug resistance is activated when the fungi get modified in your body and the medicine is not able to work. There are reports which suggest that resistance of some Candida species like we can say Cruci or Glabrata and Tropicalis, they are very resistant to itraconazole. So itraconazole should not be used for infection caused due to these species. It is advised to take the complete course of itraconazole to avoid drug resistance. Now some patients ask me question that for how long do I need to take this itraconazole. So the dose and the length of the treatment will depend on the type and site of infection and even the patient response to the treatment, and these things only can tell that how long we do need to take the itraconazole. For example, if you are taking itraconazole for athlete foot, means fungal infection of the skin on the feet and between the toes, so the dose may need to be taken for 30 days. While on the other hand, if you are taking it for the candidal infection of vagina, then dose may take about 1 to 33 days depending on the dosage. Okay, and even sometime what happens that for any other infection, usually we used to give this itraconazole for 15 to 21 days. So the if suppose you are taking it for the any infection on your skin or any other area, then minimum you have to take it for 21 days. Before that, if you are going to stop this medicine, then drug resistance will appear. So to avoid this drug resistance, you should not stop taking itraconazole without completing the entire course. This is because if you stop the medication, then your fungal infection may not get completely cured. So many times patient also tells that doctor has asked them for the blood test. So this is possible that your doctor may have prescribed blood test to monitor your liver functioning. This is because the use of itraconazole may cause serious liver damage. Therefore, if you develop loss of appetite, nausea, vomiting, sometimes dark urine is there or abdominal pain is there while taking the itraconazole, immediately inform to your doctor. One more important thing is there that if a patient is taking dofetilide medicine, then do not take with the itraconazole. Okay, because what happens if suppose the patient is on dofetilide and he is taking itraconazole, then it will cause interference in the working of the itraconazole and even in your heart. This interference can cause disturbed electrical activity of the heart, which can be harmful for the patient. So viewers, if you like this video, please share and subscribe our channel. Thank you.